This is a very important chapter that you will hear study. First, we talk about the antibiotics. What are the antibiotics? These antibiotics are the agents that act against bacteria, maybe gram positive, maybe gram negative. And first, talk about the classification of bacteria. Here, classification of bacteria are two types, gram positive, gram negative, and atypical. Now, classification of antibiotics. This is very important. The major classes are, first one is beta-lactam antibiotics. Second one is aminoglycosides. And third are the tetracyclines. And fourth are the fluoroquinolones. And fifth are the macrolides. Here we talk one by one. First are the beta-lactam antibiotics. In this, there are two major classes. First is penicillin, and second one is cephalosporins. Both the antibiotics acts against generally gram-positive bacteria because they inhibit cell wall biosynthesis. The gram-positive bacteria mainly contains, muramic acid and aminoglycosides in their cell walls. Here, these interfere with the formation of bacterial cell wall. So, these are effective, particularly gram-positive bacteria. And penicillins are the first drug that was used against the bacteria. The chance discovery is very interesting. That is discovered by Fleming. He was working in his laboratory and prepare a culture of bacteria, particularly fungus, that he went to the summer vacation and the culture was grown in a petri dish in his microbiology laboratory. After returning back, he checked a fungus released a liquid around the bacteria, and that fungus was inhibiting the growth of this bacteria. And the bacteria was not growing on particular area that was zone of inhibition. So he noted the fungus was Penicillium chrysogenus and he extracted a lot of amount and used against the microorganism Staphylococcus aureus, and particularly first was given in the mice and that was infected from a streptococcal infection. The mice was recovered after 1 week and this was prepared in a large scale and in production large uh, fungus growth has been done and the extract was collected after optimum growth and formulated as a penicillin. Thus, this is the chance discovery of the penicillin and it was used against the gram-positive bacteria. And what was the major problem with penicillin? First, this is orally inactive, and second, due to beta-lactam lactamase enzyme, this will break down. And second, allergic reactions are most powerful with the penicillin. So new inventions were done with other antibiotics like extended or modified antibiotics, extended spectrum of antibiotics like amoxicillin, ampicillin that are also effective against gram-negative bacteria. and these are prepared and some semi-synthesized in the laboratory. Then other drugs that are also prepared like cloxacillin, oxycloxacillin that are beta-lactamase resistance. Then cephalosporins were produced and these were very effective like cephalexin is first generation oral antibiotics and their second generation ciclor and third generation antibiotic cefotaxime, ceftriaxone that are parentally used in multiple cases and that are not treated by many other diseases. So now latest complicated disease are treated with third generation cephalosporins. Now second class aminoglycosides are effective particularly gram for negative bacteria and this first drug was streptomycin that was discovered by Streptomyces griseus and formulated. Then gentamicin come into the market, kanamycin and amikacin. These antibiotics are also not used in oral form because these are poorly absorbed from gastrointestinal tract. So modifications are done with this and the newer drugs. Amikacin is very useful and that is resistant to many enzymes that will inactivate this and effective in disease, particularly in children's. Kanamycin also used and some drugs also use topicals in this topical antibiotics also in the aminoglycosides. Now next is tetracycline broad spectrum antibiotics with chloramphenicol that were used against gram positive and gram negative bacteria, particularly like cholera, expanded disease in particular area, and other derivatives like oxytetracycline, minotetracycline, doxycyclines are the developed with other methods, and these are useful against all types of gram positive, gram negative bacteria. These are known as broad spectrum antibiotics. Next, macrolides are particularly effective against gram positive, like erythromycin, that is popular, roxithromycin, and now azithromycin is more popular, that is particularly has good penetration and good results. And fluoroquinolones, ciprofloxacin, norfloxacin, ofloxacin, sparfloxacins. These are the newer antibiotics that are especially uh, particularly gram negative and gram positive, genfloxacin, moxofloxacins, and lot of drugs. These are also effective in urinary tract infections, particularly Escherichia coli, that is opportunistic bacteria that will convert into pathogen during immunocompromised patient. And these antibiotics are very effective, particularly when complicated typhoid, meningitis, and first we have to diagnose these and mechanism of action is effective against gram positive and gram negative bacteria. And what are the side effects? Allergic reactions like penicillin should be sensitive for many patients, so avoid you use amoxicillin, ampicillin, ampicloxa combination, augmentin, amoxicillin plus clavulanic acid, that is beta lactamase resistance. So lot of antibiotics are available in the market, and we can modify day by day, and there is selection of antibiotics is very important. Which type of disease in the patient you have to select the microorganism is like typhoid, salmonella typhi, gram negative, like bacillus anthracis, anthrax, and gonorrhea, gonorrhea, Diplococcus gonorrhea. So these are the important disease caused by different bacteria, and selection of antibiotics is very important, and the treatment should be given according to the patient conditions. Okay, today is the this part we will discuss next in next class. Bye.